Hi, I'm Dr. Meera Balasubramaniam, Associate Medical Director of Penn Medicine, Princeton House Behavioral Health in Hamilton. Today I'm going to discuss panic attacks, sudden episodes of intense, unwarranted fear that triggers physical reactions. I'll review typical symptoms, what to do when you're experiencing a panic attack, and suggested treatments. Many people experience anxiety from time to time and can easily move on from those feelings. But for some, the feelings associated with anxiety are so overwhelming that they cause a panic attack. A panic attack happens when the mind and body work together to trigger a chemical reaction, essentially a rush of hormones such as adrenaline that tells your body to activate its fight or flight response to keep you safe from harm. As your body tries to take in more oxygen, your breathing quickens, hormones are released, your heart beats faster, and your muscles tense. For most people, a panic attack lasts from 5 to 30 minutes. Panic attacks are more common in women, likely due to differences in brain chemistry and hormone fluctuations. It's not unusual for a person to experience 1 to 2 panic attacks in their lifetime during periods of intense stress. However, when panic attacks occur once or twice a month or even several times a week, and it causes constant worry about the possibility of another attack, it's a condition called panic disorder. Like other anxiety disorders, panic attacks typically have their onset in late childhood or early adulthood. They peak in middle age, and then their frequency decreases. While they are not life-threatening, panic attacks can be frightening and debilitating. They typically start without warning and can happen at any time, even when you're fast asleep. The exact cause isn't really known, but stress, emotional trauma, and genetics can play a part. Those who experience panic attacks have symptoms such as rapid pounding heart rate, shaking or trembling, sweating, shortness of breath or a tightness in the throat or the chest, nausea, dizziness or fainting, a sense of impending doom or fear, or feeling out of touch with reality. If you have regular panic attacks, followed by at least a month of continuous worry about having further attacks, and the concern is so intense that it impacts your quality of life, you likely have panic disorder. A panic attack isn't dangerous, but it can be terrifying, largely because it can make you feel out of control. Panic attacks are also concerning because if they evolve into panic disorder, the condition may also lead to complications, ranging from mild social impairments to a total inability to face the outside world. The good news is with practice, you can learn to manage the symptoms of a panic attack and even lessen their severity. For instance, if you breathe quickly during an attack, there are specific breathing exercises that can ease your symptoms. A popular technique is 4-7-8 breathing, which involves breathing in for 4 seconds, holding the breath for 7 seconds, and exhaling for 8 seconds. By focusing on your breath, you can regulate your body's reaction in moments of anxiety, often interrupting the fight or flight cycle and keeping the panic attack from escalating. Those who experience muscle tension during a panic attack often use a technique called progressive muscle relaxation. This involves tensing and releasing the major muscle groups. It may seem counterintuitive to increase tension in already tense muscles, but by tightening the muscles a bit more, they are able to release into a calmer and looser state. If you don't suffer from panic attacks but know someone who does, you can guide them through these techniques to help them manage the moment and feel safe. Panic attack symptoms can resemble other serious health problems, including a heart attack. So, if you're experiencing a panic attack for the first time and aren't sure if the symptoms are related to an underlying medical problem, you should call 911 or have someone take you to a local emergency room right away. Do not attempt to drive yourself. A physical exam, blood tests, and other tests such as an EKG can help rule out heart problems and determine if a medical condition is causing your symptoms. The sooner you identify the cause of your symptoms, the sooner you can address them. If a physical exam and diagnostic testing don't suggest an underlying medical condition, you most likely experienced a panic attack. You should also seek immediate medical help if, during a panic attack, you're worried that you might hurt yourself or someone else. If this is the case, and if your panic attacks happen regularly, you should strongly consider seeing a mental health professional who can help you better manage your anxiety. If you're having panic attacks regularly and breathing or muscle tensioning techniques aren't helping, your symptoms may worsen without treatment. Regularly experiencing panic attacks can also lead to phobias such as fear of social situations, driving, or even leaving home. The anticipatory anxiety associated with panic attacks can also cause other problems like depression and substance use disorders. With a doctor's help, you may find that a combination of medications and psychotherapy is most effective to treat your panic attacks. For example, certain antidepressants that increase levels of serotonin in the brain can help reduce anxiety. And anti-anxiety medications like benzodiazepines can be used to manage severe symptoms. Including individual or group therapy as part of your treatment can also help. Cognitive behavioral therapy, or CBT, is commonly used to treat panic disorder. CBT teaches you new ways of thinking and problem solving, as well as relaxation techniques that enable you to respond to the feelings that happen before or during a panic attack. If you or someone you love experiences panic attacks, remember, there are ways to learn what's triggering your anxiety and techniques that can help you manage overwhelming feelings so that you can focus on the things that you enjoy.